We are back on the Lynne Hayes Freeland Show. You guys have no idea how anxious I have been to get back in the studio, have some real dialogue conversation about COVID-19, the novel coronavirus, and our community. We are doing the show. We're practicing social distancing. We are doing the show today by Skype, but I wanted to talk about this issue in our community in particular. Joining me now by Skype is Dr. Gregory Patrick. We welcome him to the conversation. He is at home. He is a specialist in lung disease who practices at Sewickley Valley Hospital. And I figured if we were going to have this conversation, we needed to go to the experts in our community. So we welcome you to this discussion, Dr. Patrick.
Thank you for having me.
Indeed. So, you know, this is one of those things that when we talk about this virus in our community, this coronavirus, it's a different conversation than a lot of the conversations we hear on the news every day because it affects our community differently.
That is right. The problem, the pandemic of the coronavirus, unfortunately, in the Black community is coming on top of the epidemic of obesity, of poverty, of heart disease, of hypertension, of lung disease, specifically COPD and asthma, that already afflicts the community. Early on in the pandemic, they were saying that Black people were more affected by this disease because we were more sensitive to the disease. That is not true. We don't catch the disease any more frequently, or we are not more susceptible than non-Black populations. The problem is that this disease comes on top of a constellation of other social ills. We are also the ones who are on the front lines. We drive the trucks, we stack the stores, we do the personal care, so that we don't have the opportunity to work from home. Also, we often lack
access.
Access. We have access to insurance, but also access to stay at home. We are more likely to have multi-generational households, more close, so that the option of sheltering in place and maintaining 6 feet of distance at all times often is not an option. So as a consequence, we are seeing the COVID hit us harder. And in addition, we must talk about racism. We are less likely to be tested. We are much less likely to have a PCP. We often have more difficulty moving through the healthcare system. And historically, Black people have not been treated well by the health system in America. As a consequence, COVID is here, it's real, and it is hitting us harder.
Here's one of the things that I think is most frustrating for me is a lot of these the scenarios that you describe, they're not new. Right. You know, there's the old saying, when America gets a cold, the Black community gets pneumonia or something much more dramatic. You know, these aren't new issues, so it's somewhat frustrating to me that in 2020, we're still talking about the same disparities when it comes to our health care, our access, and our outcomes.
That is so true. And not only that, but the larger society is always surprised that Black people would have more difficulty. As I said, the first readings were for the reason why African Americans were having more difficulty with COVID was because we were more sensitive. Also, they suddenly discovered they weren't checking. They were not keeping data or collecting data on COVID infections by race. So, more importantly, though, for our viewers, okay, a couple key things I want them to know.
Okay.
First is that COVID is real. Still in our community, you'll see the brothers can't give up the handshakes, the high fives, the hugging, okay, the closest we share as a people. And right now, we can't afford not to have social distancing. The way COVID works is that everyone's seen the pictures with this ball with the spikes on it.
Right.
Those allow the virus to attach to the respiratory cell. And then the virus then pumps its RNA into the cell, and then it hijacks the cell's DNA and the cell's metabolic process to make more of the viral RNA. And that until the cell gets filled up with the viral RNA until it explodes. Okay, and that's how. But then more viruses go to meet more of the cells, and that's how it spreads within you. So
Wait a minute, let me stop you just for a second. So I have this visual. So we kind of see these cells with these little prickly things. So they
right.
attach, and then they basically kind of blow up and then
Well,
multiply.
The viruses attach,
Uh-huh.
pump their viral cells into the normal human cell, the respiratory cell.
Okay.
The respiratory cell fills up with viral DNA, and then it explodes.
Okay. All right.
More
Wow.
viruses come,
Okay.
and that's why you get the progression until it reaches a point that you get symptoms, until it reaches a point where you can get extremely ill. The importance of that is to know that a lot of things you'll hear about, okay, ways of protecting yourself from the virus. I've heard of drinking warm liquids. I have apple cider vinegar. Has been offered because apple cider vinegar is supposed to be a fat burner, and therefore, since the virus particle is fat, it's supposed to be effective, and so forth. All those topical products are not effective once you get infected because the virus is already in the cell. So that use topically won't work. Now, it's good to be hydrated. Green tea is another thing that's offered. Certainly won't hurt you. But the major things, the major defenses that we have against the virus are, social. Well, first is good health.
Okay.
If you have high blood pressure, if you have diabetes, if you have COPD or asthma, take your medicine.
Okay.
There's a tendency now you're stuck at home. You want to go for the comfort food. Why bother with the diet? Why bother with? And I can't argue it myself. It was hard. Fortunately, this happened during Lent, so I was being observant, which made it easy. But now that Easter's over, I mean, my food is calling me. But if you're better control of your diabetes, the better your blood pressure control is, the better your lung disease control is, the better you will do if you become infected.
Okay.
That's the first thing. Second thing, social distancing works and masks work. Now, the interesting thing about masks, what happened was back with influenza, the CDC did a bunch of studies and showed that wearing masks did not seem to make a big difference. That's why the initial reports were from the CDC that you didn't need masks. The masks were effective except for the 95 ones. More recent studies have shown that this virus in particular is spread by droplets, so that turns out that the barrier of a mask over my mouth protects, if I'm coughing, keeps stuff from coming out and keeps it from spreading to you, okay? Similarly, wearing a mask protects any coughing you do from getting to me, but also that mask keeps any particles I might have coughed from reaching you. So more recent data has shown that masks do work, especially when masks are combined with hand washing and social distancing.
Let me just
Now,
ask you one quick question, because we only have about a minute left. So as
sorry.
you and I talked about, we're going to have to do more than one show here. But here's the reality, Dr. Patrick. When we talk about masks, we talk about African-American males and masks. That's a whole nother conversation, because
Yes.
there's a perception that black men wearing a mask become threatening, intimidating, and there's a lot of black men that don't want to go out in a mask because they feel like they're going to be attacked or worse.
That is true. There have even been instances where black men, I saw a video where 2 young black men were followed through a store
Right.
as they were wearing masks. Unfortunately, we will have to teach our young men, masking while black is just like we have to teach them driving while black. And in America, there's no way to reassure white people that we are intrinsically not a threat. I don't know of any way to avoid that, but most importantly, if you wear a mask, and if anybody asks you, you say, I'm protecting you and I'm protecting me.
Okay.
All right. And just be upfront. I am social distancing. That's why I'm wearing a mask. I'm sorry. I'm scared. Okay. You don't want me to off on you.
Indeed. We'll have to have you back. A lot more to talk about, but thank you so much for joining us this morning. I'm telling you, there's so much we have to talk about. Dr. Patrick, we appreciate you indeed, sir.
Thank you so much, Lynn.
All righty. We'll take a break. When we come back, we have another. See, I'm telling you, we got experts right here in our own backyard. We have another doctor who's going to weigh in on this, so stick around when the Lynne Hayes Freeland Show continues.